Once upon a time in the year 2000, the prestigious journal JAMA published an initial report stating that iatrogenic death, that's death caused by medical treatment, was estimated to be the third leading cause of death in America based on statistical models and rough estimates. In 2013, the Journal of Patient Safety began an investigation of the hard numbers and were counting reported iatrogenic deaths. They tallied over 440,000 deaths per year in hospitals alone, where the numbers were most readily available, but the numbers become more damning when the medical mistakes outside of hospitals, like deadly reactions to prescription drugs, were added to the toll. Christine Martin Anderson, MBA, a senior vice president at Booz Allen Hamilton for the healthcare sector, warns that, quote, "Unfortunately, only a fraction of medical errors and near misses are actually reported. The numbers could be substantially higher." And she's right. The numbers are just the tip of the iceberg. The overall reporting rate for medical errors is staggeringly low. Hospital errors, the 1 in 7 rule. A landmark study of the Department of Health and Human Services, Officer of Inspector General, found that hospital incident reporting systems miss 86% of events. That means that only 14%, 1 in 7, of actual patient harms are ever documented in the official hospital logs. Medical devices, the 0.5% floor. For specific equipment failures such as ventilator malfunction or heart monitor failure, the FDA estimates the report rates can be as low as 0.5%. Adverse drug reactions. Independent researchers often estimate that only 1 to 10% of serious adverse drug reactions are ever reported to the FDA's MedWatch system. COVID-19 even confirmed that VAERS' underreporting factor was 41 times, or less than 1% of complications were reported, and only 2.4% for serious, life-threatening problems. Now, officially, the industry does not want any oversight and asks the public to presume that medical mistake reportings will be voluntary. Interesting. But let's head on over to the CDC and see, as early of 2026 when this video was made, what they say are the actual leading causes of death. These are 2023, 4, and 5 projected. Are you noticing anything absent? I'm not seeing medical mistakes anywhere in the top 3 where they know they should be. It's not anywhere in the top 10 either. That's weird. It's odd that before 2015, the CDC used to release a standard list of 113 selective causes of death for their annual reports. And if you pulled up one of those charts, guess where iatrogenic deaths was listed? It wasn't. Now hold on here. The CDC claims that, quote, preventing human error is part of their mission statement. There is certainly a disconnect between the actual data and their published reports. But why and how? Death certificates typically list both the immediate cause of death and the underlying cause of death. The immediate cause of death is the final disease, injury, or complication that led to the person's death. The underlying cause of death is the condition that initiated the events resulting in the person's death. For example, if someone dies from a medical mistake, immediate cause, and they were in the hospital because they sprained their ankle, underlying cause, the CDC will only take the non-medical error for their figures. This seems dishonest to me, saying that a sprained ankle took them out. Before he was head of the FDA, Dr. Martin McCary and 3 other doctors from Johns Hopkins Department of Surgery wrote an open letter to the CDC in 2016 asking them to classify medical mistakes honestly and correctly. As of the making of this video, the CDC refuses to do so. Quote, "Too often," Dr. McCary admitted, "the healthcare sector silences people around a problem." If one conservatively factors the massive underreporting and includes death from adverse drug reactions and unnecessary surgeries and outpatient errors, we get a number just under 784,000. That's 90 deaths a minute across the country. Let's look at the list now. Well, look at that. Iatrogenic deaths are higher than, well, anything else. In fact, every number on this list is wrong. They are inflated because they hide their medical mistakes in each category. What's interesting that if you take out the hidden medical error numbers from each category, medical mistakes take out more people than causes number 3 to 113 combined. In real numbers, that means if anyone is going to die in America in any given year, there is more than a 25% chance that the medical system is going to take you out by mistake. In talking with an informant at the CDC who demands that I keep their identity anonymous, they told me a phrase that lives rent-free in my mind. And I think about this every single day and probably will for the duration of my life. They said the reasons why the CDC lies and hides the truth, with full support and backing of the government, and all the alphabet agencies and every single media agency, is that if it got out, it would, quote, undermine public trust. I mean, in your personal estimation, if 4 to 5 jumbo jets a week crashed in America due to pilot error, how many years would it take before they'd stop all jumbo jet flights? I don't think it would take a week. But wait, wouldn't that undermine your trust in the airline industry? Yeah, what's wrong about that? And yet the healthcare system goes on day after day, year after year, decade after decade. And it's not just deaths. Harvard showed that another 2.5 million people a year are maimed or disabled because of these medical mistakes. In the book SuperFreakonomics, it perfectly confirms the data regarding iatrogenic deaths. When doctors actually stop working, like during widespread strikes in Los Angeles, Israel, and Colombia, the overall death rate plummets by 18 to 50%. And it's not just because people put off elective surgeries. When a massive medical convention pulled a huge number of doctors out of Washington, D.C., mortality rates dropped across the board there too. Why? Because the system aggressively overtreats non-fatal problems. They throw unnecessary, harmful medications and procedures at you, turning the amplitude up until the treatment becomes the danger. The data is clear. If you have a massive acute trauma, the hospital slightly increases your odds of surviving. But if you don't, walking into that building actually increases your odds of dying. Now, I believe if you don't have a solution, you're just whining. It's intellectually lazy to sit back and blame. I think raising awareness is kind of stupid and virtue signaling. I have no hate in my heart. I have no axe to grind. No friends or family member of mine died from a medical mistake. I'm just a medical researcher who's scouting for truth. The truth is a problem that is complex with many factors. 1. 97.5% of the people in the healthcare industry can't admit they're wrong when new data is presented. It's because they identify as people who help others, instead of people who scout for truth in their quest to help others. So when data comes along showing that what they were doing wasn't helping, cognitive dissonance prevents them from seeing it. You can watch why 97.5% of people in the healthcare sector can never admit they're wrong to find out more. And 2, iatrogenic death and injuries are simply the bitter fruit of a bitter seed. I don't care how smart or rich the people were who came up with the formula. I only care about results. And I judge by fruits in real life. If the medical model is wrong, it doesn't matter how caring anyone is. It doesn't matter how they identify themselves. If anyone is using the wrong formula, they will never get the right answer. It's time to stop and rethink. The Western medical model of reductionist medicine is a lifesaver for trauma. If you're bleeding out, they know how to fix the machine. But the second we cross into non-traumatic disease, that Newtonian model completely falls apart. It's exactly like physics. Classic mechanics works perfectly right up until you hit the quantum level, and then you need a completely new set of laws based on current science. I spent 25 years researching, and I have connected all the missing links to create a new medical model. Watch Secrets of the Outlier series, which concludes with what all the scientific evidence points to as a more complete medical model. Unfortunately, complex problems can't be solved with finger-pointing, sound bites, short-form video, or on-stage debates. It's a long series, and I cut them up into smaller bites. And don't confuse this with functional or the alternative crowd. This isn't about eating organic, exercising, or biohacking. Science actually confirms that those are tiny, insignificant weights when tipping the scale of your health. The true drivers of a fulfilling, disease-free life are what I call the 3.5 hurdles. These are the foundational boulders that no doctor, no diet, or exercise, and no quantity of biohacking can outweigh. I have one request. Please don't use this video as a weapon. Don't shove it in people's face just to prove them wrong. It's only going to cement the walls between us. There are powerful people funding and delighting in our infighting over silly things. We all suffer from cognitive dissonance, and the internet and modern media have amplified it above pathogenic levels. Let's be humble. Admit we've all been duped. I sure was. Let's all adopt a new identity as someone who seeks truth as defined by real-world sweet fruits. The first video in the Secret of the Outlier series is a video called The Anthem of Truth, which clearly defines the problem. And then everyone said I needed to make another video about the solution. So linked below you'll see a video entitled How to Solve the Plague of Cognitive Dissonance.